What if I told you that one simple habit you do for just 3 to 5 minutes before bed could lower your risk of stroke, calm your racing heart, and stop those painful leg cramps that wake you up at 2 a.m.? And what if this habit has quietly been practiced for generations in Japan, one of the countries with the highest life expectancy in the world? Tonight, before you go to sleep, you may want to try this, because ignoring your body at night could be the reason your legs feel heavy, your feet tingle, or your blood pressure spikes while you rest. Before we continue, take 1 second to like this video and subscribe to Human Health Explained. It truly helps this channel grow, and it helps more people over 50 discover simple habits that can protect their health naturally. Now let's get into it. In many Japanese homes, especially among older adults, nighttime is not just about lying down and closing your eyes. It is a transition, a gentle reset for circulation, nerves, and the heart. One quiet practice stands out. It looks simple, almost too simple, but its impact on blood flow, muscle relaxation, and nervous system balance is powerful. The habit is this: a short, gentle leg elevation and ankle pumping routine done right before getting into bed. Now, you might think, how can something so small prevent something as serious as a stroke? The answer lies in circulation. When we sit or stand most of the day, gravity pulls blood downward. Over time, blood pools in the lower legs. Veins work harder to push blood back up toward the heart. If circulation slows, pressure builds. The heart strains. Blood pressure can rise, and stagnant blood flow increases clot risk, which is one of the major causes of stroke. In Japan, especially among older adults who sit on the floor or use low seating, there is strong awareness of circulation. Before bed, many people lie on their backs and elevate their legs slightly, sometimes against a cushion or even a wall, for just a few minutes. While doing this, they slowly flex and point their toes, rotating the ankles in controlled circles. This movement activates what doctors call the calf muscle pump. The calf muscles act like a second heart. Every time you flex your ankle, those muscles squeeze veins and push blood upward. This gentle pumping improves venous return, meaning more blood flows back to the heart efficiently. When the heart does not have to struggle against pooled blood, nighttime blood pressure can stabilize. For people over 50, especially those with mild hypertension, this small improvement in circulation before sleep can make a big difference over time. But that is not all. Let's talk about leg cramps. If you have ever woken up with a sudden sharp cramp in your calf, you know how painful it can be. Night cramps often happen because of dehydration, mineral imbalance, or reduced blood flow. When circulation is sluggish, muscles do not receive steady oxygen and nutrients. During sleep, when you are not moving, that can trigger sudden muscle contractions. The Japanese night routine addresses this directly. The slow ankle pumps increase blood flow. The gentle leg elevation reduces swelling. Some people also add light calf massage using their hands, pressing upward toward the knee. This encourages lymphatic drainage and reduces fluid retention. Over time, people report fewer nighttime cramps and less restless leg discomfort. Now, imagine doing this every night for just 5 minutes. No equipment, no gym, no complicated breathing techniques. Just you, your bed, and gravity working in your favor instead of against you. There is another layer to this habit that many people overlook. When you elevate your legs and move them slowly, you activate the parasympathetic nervous system. That is the part of your nervous system responsible for rest and recovery. Slow, controlled movements, combined with deep breathing, signals safety to your brain. Your heart rate slows, stress hormones begin to drop, and your body prepares for deeper sleep. In Japan, long life is not only about diet like fish and vegetables, it is about daily rituals that reduce strain on the body. Small, consistent actions. This night routine is one of them. It supports the vascular system, which includes your heart, arteries, and veins. And since stroke is closely linked to blood pressure, arterial stiffness, and clot formation, improving circulation before sleep is not just about comfort. It is about prevention. Let me explain something important. Most strokes happen either because a clot blocks blood flow to the brain or because a weakened blood vessel bursts. High blood pressure is one of the biggest risk factors for both types. When blood pressure stays elevated, vessel walls become damaged. Over time, that damage increases risk. Now think about your typical evening. Many people eat dinner, sit on the couch, maybe scroll on their phone, and then lie down suddenly. There is no transition for circulation. No reset. The heart shifts from upright activity to horizontal rest without assistance. By elevating the legs for a few minutes, you allow gravity to help return blood smoothly. You reduce pressure in the lower extremities. The heart experiences a more balanced flow, and when combined with slow breathing, you lower sympathetic stress signals. That combination supports healthier nighttime blood pressure patterns. If you want to try this tonight, here is how to do it safely. Lie on your back on your bed or on the floor with a comfortable mat. Place a pillow or two under your calves, so your legs are slightly elevated above heart level. They do not need to be straight up against the wall unless that feels comfortable. Slight elevation is enough. Now slowly flex your feet upward, pointing your toes toward your face, then gently point them away. Do this 20 times. After that, rotate your ankles in circles, 10 times clockwise and 10 times counterclockwise. Move slowly. No jerking, no forcing. Breathe in through your nose and out through your mouth. As you move, if you want to go one step further, gently massage your calves upward using both hands for about 1 minute per leg. Keep the pressure light to moderate. This is not deep dish massage. The goal is stimulation, not pain. Many older adults in Japan also pair this with a warm foot soak earlier in the evening. Warm water relaxes blood vessels and increases peripheral circulation. Even if you do not do the soak, the leg elevation and ankle pumping alone can make a noticeable difference. Now, let me be clear. This is not a replacement for prescribed medication. If you have high blood pressure, heart disease, or a history of stroke, you should always follow your doctor's advice. But adding a safe, gentle routine like this can complement your medical care and support overall vascular health. Here is something interesting. Research shows that even small improvements in circulation and blood pressure can reduce stroke risk over time. It is not always about dramatic changes. It is about consistent habits. 5 minutes per night equals more than 30 hours per year of improved circulation support. That adds up. That, if you are over 60, this routine may be especially valuable. As we age, vein elasticity decreases. Valves inside veins become less efficient. That is why swelling, varicose veins, and heavy legs become more common. Activating the calf muscle pump daily helps compensate for that natural decline. You might also notice better sleep. When legs feel lighter and less restless, your body can settle more easily. Deep sleep is when blood vessels repair and the brain clears metabolic waste. Protecting sleep quality is another indirect way to protect the brain from stroke risk. I want you to imagine something. Tonight, instead of scrolling on your phone until you feel exhausted, you dim the light, you lie down, you lift your legs slightly, you move your ankles slowly, you breathe deeply, you feel your heart calm down. That moment of intention signals that you are choosing prevention instead of reacting to illness later. This is how longevity works in places like Japan. It is not magic. It is not one miracle food. It is small, consistent habits practiced daily without drama. And here is the most powerful part. You can start tonight. You do not need to buy anything. You do not need to wait for Monday. Just 5 minutes before bed. If you decide to try this routine tonight, I would love to hear from you. After a week, come back and tell us in the comments if your leg cramps improved or if you felt more relaxed before sleep. Your experience could inspire someone else to take action. And if you know a parent, spouse, or friend over 50 who struggles with leg cramps, high blood pressure, or poor circulation, share this video with them. Sometimes one small habit shared at the right time can protect a life. At Human Health Explained, our goal is simple. We break down complex health science into practical steps you can actually use. No hype, no confusion, just clear guidance for real people. So tonight, before you close your eyes, remember this. Your legs are not just for walking. They are part of your circulation system. When you help them pump blood back to your heart, you help your heart protect your brain. And protecting your brain means protecting your independence, your memories, and your future. Try the Japanese night habit. Stay consistent and give your body the support it deserves. I will see you in the next video.